Welcome to another episode of Kaleidoscope Corner. My name is Melanie Maldonado, and today we have my co-host Bijan Farouz and Craig DiVincenzo, our program director for all our facilities. And today's topic is going to be about experimental designs. So Craig, thanks for coming in.
Sure, my pleasure, guys.
Can you tell us what are experimental designs?
Okay, so experimental designs are the ways in applied behavior analysis that we make sure that our interventions are effective and that they are appropriate. They help us to determine if there is what we would call a functional relationship, or a cause, if you will, in a change in behavior because of a certain type of intervention. So let's say, for example, I put in a reinforcement procedure to increase hand raising in the classroom, right? That's what I want to do. So an experimental design will help me determine if that reinforcement actually causes a change in behavior that I'm looking for, hand raising. It helps us to eliminate ineffective behaviors, ineffective interventions as quickly as possible. So if we put in an intervention and it's not working, if we have a well-designed experimental design, we're able to identify that and make changes to it quickly, and that helps us as well. Yeah.
Now, Craig, let me ask you, what are some types of experimental designs that apply to behavior analysis?
Sure. So in behavior analysis, we predominantly use what are called single subject designs. And in a single subject design, so in a lot of studies, you'll see a control group and an experimental group. Well, in behavior analysis, we don't usually do that. We usually take one person and they serve both their control and their experimental. So in our designs, there's a number of different ways that we would do them. The most common is what's called a multiple baseline design. And that would be that I have the three of us, let's say, for example, and we're going to put in an intervention for reinforcement for hand raising in class across the three of us. So what we would do is I would start in baseline, so no intervention for the three of us. Then I would put yours in first, still keep Melanie's and I in baseline, and then put Melanie's, still keep mine in baseline, and then add mine. And what that does is if there's a change in all of our behaviors when we put in the intervention, that would tell us that that's because of that intervention. We've been able to eliminate what we would call extraneous variables. And extraneous variables are things like time, other interventions. Did I just not sleep well that night? Did I not eat very well, or something like that? So to sort of eliminate those sorts of things. There's other types of designs too. We might use what's called a reversal design. So I might do a baseline, then put it in an intervention, and then take that intervention away. And what should happen is the behavior should go up and down in accordance with my intervention. And that's pretty much the types of designs that we would use. There's a couple of others, but those are probably the two main ones that we would use.
Very good.
Awesome. Thanks for coming in.
My pleasure.
Hey, you did such a great job of explaining. If you have any more questions, please refer to your behavior analyst.